Hi, I'm Abby. I'm one of the hygienists at Brookhaven Family Dentistry, and one of the most frustrating issues that I see with my patients is people that feel like they're doing absolutely everything right, but they're still getting cavities. When that happens, we have to look at a couple different reasons. It could be brushing and flossing related, it could be diet, it could be the bacteria that they have in their mouth, or it could be the way that the teeth formed. Ultimately, when somebody's high cavity risk, we need to look at all of those things and help mitigate those risks where we can. The risk factor we have the most control over is brushing and flossing. But what happens when somebody has been doing that? They're flossing every day, they're brushing with an electric toothbrush, maybe they're even using a water pick, and they still keep getting cavities. Well, then it's really important that we start looking at their dietary habits. What are they eating every day? How often are they eating? What are they sipping on throughout the day? If we can look at those things and find where improvements can be made, that can make a big difference for patients. Digestion starts in the mouth. We have an enzyme in our saliva called salivary amylase, and the way that that works is it starts to break down anything that we put in our mouth into simple sugars if it can. The more complex digestion happens in the stomach and the intestines, but simple sugars are quick and easy fuel for our cells and our brain, so getting that into our bloodstream quickly is really effective. With that, the bacteria in our mouth feed on those simple sugars, and every time we expose those bacteria to those simple sugars, they start to release acid. That acid lowers the pH to a more acidic level in our mouth, and that acid is what breaks down the enamel of our teeth. If we can limit the amount of acid that our teeth are exposed to, then that can help prevent cavities. What does that mean for our eating habits? Well, if we can limit the amount of time that our teeth are attacked by acid, then that can help keep our teeth healthier and our enamel nice and strong. Every time that we expose our mouth to anything with fermentable carbohydrates, so that's anything that breaks down into simple sugars, we are exposing our mouth to a 30-minute acid attack, and then studies show that it takes about another 30 minutes for the acid levels in our mouth to come back up to pH neutral. When we look at how often teeth are exposed to acid, there's a certain amount of time that is normal for normal eating and drinking habits and is to be expected. So what we're looking at when it comes to cavity risk is those times that fall outside of normal meal times. So maybe your coffee drinking in the morning, or your mid-afternoon snack, or that late night dessert. Those acid exposing times lower the pH of our saliva and keep our mouth outside of neutral, which bumps us into a higher cavity risk. Things that aren't high in sugar but are very acidic, like black coffee, while they aren't necessarily cavity causing in nature, they can contribute to our acid levels, which do put us at higher risk for cavities and also acid erosion. So what foods should we be avoiding? Anything that is starchy or high in carbohydrates or breaks down into simple sugars in our mouth. So that's going to be your goldfish crackers, your Cheez-Its, your fruit gummies, and anything that's sticky that's going to stick around. Those things are high cavity causing and we can have them, but we should keep them to meal times. So if you're going to pack some fruit gummies for your kids, you should pack them at lunch and then ask them to give a really good swish around with water afterwards. That way they are able to help buffer that pH and keep that stuff from sticking right on their teeth. A sugar source that you might not have thought about in kids are going to be your sports drinks. So if we're talking about a good moist mouth is a nice pH neutral mouth, and kids go out and they get really hot playing soccer or football and their mouth gets really dry and they're really thirsty, those electrolytes in Powerade and Gatorade can be really important, and those simple sugars are really important for fueling their body as well. But they can actually cause a lot of damage to our teeth because we are exposing them to that acid over time, and especially during a time when we're maybe not drinking as much water and keeping our mouth as neutral, that can be a really important factor. For adults, the two biggest culprits are going to be soda and then iced coffee. A lot of iced coffee drinks these days have a lot of cream and sugar, and because they're iced and our time isn't as limited on how quickly we'll drink them, we may drink them throughout the entire day. That acid exposure puts us at high cavity risk. We've talked about the bad stuff, but what about the good stuff? So we're talking about crunchy vegetables, leafy green vegetables, meats, nuts, all of those things are great choices. You want to make sure you're getting plenty of calcium because calcium helps support our healthy bone levels. And then the biggest number one is water. Making sure that we're drinking plenty of water throughout the day, whether you get that water from the tap or from a bottle. Bottle, of course, doesn't have fluoride. Tap does have fluoride. So both of those options are great choices. Wherever you get your water, just drinking water throughout the day makes a huge difference. I hope this video gave you some good food for thought on how to make good healthy choices in regards to lowering your cavity risk. If you have any questions, shoot us a comment down below. As always, like and subscribe, and we appreciate you following along.
Hi guys! I know one of the most frustrating things for a lot of my patients is thinking that you're doing absolutely everything right, but not being able to avoid getting cavities. If you feel like you're stuck in this cycle, I just recorded a video about small dietary changes that you can make to help lower your cavity risk, and it'll be over on our YouTube channel soon. Thanks so much, have a great day!